Okay, I think we're ready. Wow, thank you everyone for coming to our 7th annual Legislative and Governmental Forum. We're doing this differently this year, obviously, because of COVID-19. And I just want to acknowledge our wonderful IT team. We have David Lockhart, Brad Bento, Dan Benson on our IT team, and they're the ones who really got this whole thing together, figured it all out, because I had no idea what I was doing. And Mindy Greenwood has also been very instrumental in getting everybody ready for all of this. So thank you all very, very much. I really appreciate it. And United Way and Debbie Campbell, thank you for your participation. United Way has been a part of this for the last, I think, 4 or 5 years or so, and we really appreciate their helpfulness in getting this going and started and getting the message out to people. On our panel today, we have, on our legislative and governmental panel, we have Senator John Braun, we have Sheriff Rob Snaza, we have Commissioner Edna Fund, we have Representative Ed Orcutt, we have Senator Dean Tacko and Representative Peter Urbano. And they are going to be talking just for a couple of minutes before we start with the presentations, and kind of what's on their radar for this year and what they're going to be looking at as they enter into this next year in legislation and in their different panels that they belong to. So, Senator Braun, I'm going to ask you to go ahead and start us out and just kind of tell us what's on your radar today and for this next year. And I think we can, do I need to unmute Senator Braun or does he need to do that himself?
We're working on it. They joined a little late.
Okay. All right. Thanks.
I'm on now. Can you hear me?
Yes.
Okay. I could see you, but I didn't have any way to talk to anyone, so I was unsure what to do.
Okay. Okay.
Yeah, somebody fixed the problem. It's all good now. Anyhow, so let me turn my video on too. Oh, you're not allowing video. That's fine. Uh-oh.
You should be able to turn your video on, I would think.
It says you cannot start your video because the host has stopped it.
Oh, well, we'll fix that.
We're looking into it now.
Oh, there we go. So anyhow, first of all, thanks for having me. I appreciate it. This is always an informative group every year as we get ready for the legislative session. And this, of course, is a little unusual that we're doing this all virtually instead of over there in Centralia as we have historically. But nonetheless, I think it's a good opportunity for us to hear from the community on what's going on. So for me, the big focus on behavioral health is really how is the executive branch doing in implementing the plan we put together in 2019. And this is the first full year of implementation. And I think we've had some hiccups because of COVID. I also think we're maybe not quite on track in a couple things, although I've heard some good things recently. I'll be curious what people have to say there. And I think that'll be a big focus of the legislative session, evaluating where we stand, where we need to make course adjustments, and where we got the funding and the plan right, and how we go from there in terms of building out both state capacity, workforce development capacity, and community capacity all over the state. So that's big focus for me. And then I think kind of more broadly, I'm really interested in what are the shutdowns and other restrictions associated with COVID doing to our collective mental health situation, how that's stressing the system, how the system's responding to that. And then the last I would say is we've got a big change going on to MCOs, and how is that working in terms of providing services and funding for services in communities around the state. And of course, I'm particularly interested in the communities in the 20th legislative district. So that's what I'm thinking about this year as we get ready for legislative session. I look forward to hearing from others on what else should be on our radar. Thank you.
Thank you, Senator Braun. Representative Ed Orcott, would you go next, please, and kind of talk about what's on your radar for this next legislative session?
Sure. Thanks. Thanks for hosting this again.
Absolutely.
It's a great opportunity for us to hear from you, and I think that's probably one of the most important things is for us to hear what's going on in the mental health sector right now, and what kind of challenges that you're facing, whether it be because of COVID or anything else. So a lot of what Braun talked about are things that I think are going to come up this year, and legislators are going to be looking at. The one thing he didn't mention that I think is going to be on the agenda this year is in relation to police reform. And there's been a lot of talk this year about sending mental health professionals in instead of police. And one of the things that I'm going to be watching out for is to make sure that we're not getting so ratcheted up on that we're just sending you in instead of sending the police, but maybe trying to figure out when there's what's safe to send you in for and what isn't. Do we need to send police there first to stabilize the situation and make sure it's safe, then have the mental health professionals come in and treat the underlying cause? But I want to make sure that we're not just sending you into a dangerous situation. So that's one of the things that I'm going to be looking at and watching as any legislation progresses regarding police reform and replacing it with community service providers, is to make sure that those community service providers, especially mental health professionals, I think that's primarily who they're talking about, but other social services as well, that you've got a safe situation to go into, and that we're not putting you into a dangerous situation that you're not trained to defend yourself on. So that's kind of what I'll be looking at.
Thank you, Representative Orcott. I really appreciate you being here. Senator Dean Tackle, would you like to go next and kind of talk about what's going on in your neck of the woods?
I don't see him present here.
Okay. So let's go to newly elected Representative Peter Urbano. Peter, why don't you talk about kind of what's on your radar and what you're concerned about for this next year as you enter into the new legislative session? I think you're still muted, Peter. It's always fun.
How about now? Am I on now?
We can hear you.
All right,
Yeah,
there you go.
yes.
All right, so first I want to thank Cascade Community Healthcare and the United Way of Lewis County. I participated in this for the last, I think, 5 years or so, and it's a great opportunity not only for elected officials to hear from community members, charitable organizations, government agencies, but for them to hear from each other on what they're doing so they can coordinate, be efficient, not duplicate services, and really get the best bang for the buck. And that to me has always been one of the greatest benefits of this legislative forum. For me, as a newly elected representative-elect, I'm going to be looking at how COVID-19 and the shutdowns and the stay-home orders have impacted our children. I have a second grader and a fourth grader. My wife's a teacher. I see the impact on my family and these children, and how we're going to address these increased needs with children as they return back to school, hopefully sooner than later. But also these a lot of families. I mean, we're seeing substance abuse rates increase, domestic violence rates increase, mental health issues, self-medication, housing instability. For years and years, we've talked about lifting families out of poverty, 30% of families out of poverty by 2030. That's been a goal and a mission of the United Way of Lewis County. I fear in the past year that's been set back. So how far has it been set back? And how can we address those issues that really have been magnified this year? And that's a huge concern of mine. And I know that we've got amazing people in our community who have great ideas and are working hard. And I look forward to working with them on solving some of these and mitigating some of these. So again, thank you for having us.
Thank you, Representative Arbonne. I really appreciate you being here. Commissioner Edna Fund, why don't you go next and not do your presentation, but just kind of talk about what's been going on.
Yes. So as I finish my term, December 31st this year, looking back, I've been attending all of your forums, and it's always been very helpful for us who are seeing the issues and having that dialogue. I've appreciated that. From the county's point of view, and I'm going to be talking about the Washington Association of Counties and our legislative agenda. Some of the issues we have, of course, is medical services provided in the jail. As you're probably aware, Medicaid benefits are suspended during incarceration, and we believe that should not be borne by the county and should be paid by Medicaid. Behavioral health, as was mentioned previously in this COVID-19, there are people in need because of behavioral health issues and not being able to talk to one another face to face. And if you try to do telehealth, you need good broadband, and that is a big deal in Lewis County. We don't have that across the county. And as we know, the schools who've had to go virtual, that they've had a difficult time, especially when the parents are at home and the kids are at home and they're all trying to get online, and they may have service, but it goes very slowly. We are also concerned about COVID-19 in the future. So budgetarily, what does that mean? We've received dollars, and that's great, but for the future, what is that going to mean for us? Our health department is just scurrying with work, and it continues and continues, and now we have a large spike of cases. So we're wondering, okay, in the future, what does that mean for us in terms of our budget and being able to provide services? Anyway, once again, it's wonderful to be on this panel, and thank you all for your service. Thank you.
Thank you, Commissioner Fund. I just want to say I really appreciate all the advocacy that you've done for behavioral health and for Cascade. And Commissioner Fund and I met every single month to talk about behavioral health issues as they come up, and so it was really my privilege to work with you and be a part of what's going on. So thank you for your service. I really appreciate it. Thanks for being here. Sheriff Rob Snaza, you're up next.
Well, can you hear me?
We can hear you. We can't see your picture, though.
Well, I tried. I'm going to blame it on my cheek.
Okay.
First of all, I want to thank everybody for being on.
Oh, there you are. There you are.
Here we are. I've always enjoyed being on this forum, and I do appreciate being on here. I have a different perspective than what everybody else on this panel has. Legislative, we do look at police reform, and they have all these wonderful ideas of how we should go out and enforce and have people with us dealing with these these people in crisis. But I want to tell you, with the assistance of Cascade, when it comes to our jail facility, I want to tell you that we have some of the best individuals there with Cascade Mental Health, working along with some of our NAF care professionals and our corrections deputies. And together we have seen an increase and a lot of activity regarding those individuals who've come in a crisis situation, whether it's drugs, mental health, or all of the above. We continue to see an increase in this. And, we've worked, Dr. Stride, I just want to tell you, thank you for your partnerships with our telepsych program. We are now seeing more individuals that really need to see a doctor through telepsych, and it has worked successfully. We're continuing to be innovative in how we're dealing with the mental health crisis, the COVID crisis, drug abuse, homelessness. We see firsthand the increase of, again, homelessness, or we've seen an increase in suicides, attempted suicides out on the road. I believe our suicide rate was doubled in early May and has since increased. We show concerns for that as long as the COVID crisis continues. We're working with Cascade and other mental health professionals to deal with individuals in a crisis. And as we enter the holiday season, especially, is a time where we all need to come together and think holistically of what we want to do globally to address a lot of these issues that we're all talking about, but we need to do some. And I'm hoping that we can get some traction. We talk about police reform. Well, bringing, and I'll go back to when they talk about police reform and bringing, DCRs with us or responding. They have gone to places where we've requested them to respond to, and they've done a magnificent job. But I think we really need to look at how law enforcement's responding to these situations. First of all, someone's in crisis. Generally, our response is someone's wanting to commit suicide or has a suicide ideology of thinking about they wanted to harm themselves. We go in, we make the resident secure, and we ask them if they want to talk to somebody. And at that time, we call mental health or we call a DCR to come out to their residence. And they have at times and have been very good about that. We still need to have law enforcement involved in this, and working the partnerships that we do with Cascade, I can tell you, is beyond reproach. And I just want to thank a big plug into you, Dr. Stride, and you didn't pay me for it, so I'll just take a free cup of coffee later on. But what we're doing in Lewis County, I will tell you, should be a model of what other organizations should be doing. Our Corrections Bureau is top notch when it comes to dealing with those in crisis and working with mental health in our facility. And I couldn't give Chief Sweet and his staff enough praise for all the work that they do there. So thank you for your time and opportunity.
Thank you, Sheriff Snoz. I really appreciate that, and appreciate you being here. And Sheriff Snoz and I meet about once a quarter and talk about things that are going on in the jail and changes that may need to be made there. And we also enjoy some fellowship and food together. So that's going to continue. So thank you, Sheriff. I really appreciate you being here. How this is going to work is we have quite a few organizations that are going to be presenting today, and they're going to have a certain amount of time. And Dave, are you our timekeeper? Dave, are you our timekeeper? Make sure our panelists and our presenters are on task. So how this is going to work, it's going to work similar to what we've done in the past. I'm just going to announce the organization that's going to be talking, and then when you get up, if you will introduce yourself and what you do for the organization that you're representing, and then we'll have some time at the end in case any of the panelists have questions for the presenters. So first up, we have Cascade, Mindy Greenwood. I guess Brad is going to be our timekeeper. You're muted, Mindy. So much fun. all this stuff that we do. Thanks again to our IT team. We'll get you.
Okay, does that work better?
There you go.
Okay.
Gotcha.
Okay. They were trying to give me a fancy microphone, but I don't need that stuff. So I wanted to respond to a couple of things before I go into my little spiel. One of the biggest things is the COVID. I will tell you on the SUD side, we have seen a huge increase, enough to where I'm even expanding my staff because of the response. We were one of the few agencies that very quickly came back in after we went into the first shutdown because our clientele really needed to be seeing us in person, not over Zoom, those kind of things. SUD, trying to do SUD services in a group setting over Zoom when we have low connectivity. A lot of people are on government phones, so they have small amounts. Their packages are small, so they don't have a lot to use for that. Didn't work for us. Phone was working better, but in person is much better. So we are probably seeing 20% of our clientele in person and 80% doing telehealth with them. But we are staying in contact with our clients. Overdose, we had 4 overdoses in 3 months. They weren't actually our clients, but they were somebody who we had been seeing right up to COVID. And then with COVID hitting and everything shutting down, we lost contact with them and found out a couple months later that they'd had overdose. To me, that's unacceptable. We need to be looking at that. So those are kind of some of the things that I'm struggling with the COVID. Most courts here in Lewis County, well, I will say all courts in Lewis County I've been having some good luck with. Love working with them. I check in with them about every other week about what we're doing with our services, how we're doing stuff, because trying to get the random UAs and those kind of things for reporting has been difficult. Some of the courts outside of our county they're pushing me to make sure that I'm still doing that for reporting, but with us being under the emergency, I can't force people to come in. I have to offer the telehealth. So it's just interesting, different pockets of the state of them willing to work with us. So it's been hard as a service agency to do that. So that all being said, I'm going to go ahead and go into my presentation. As you all know, 2 years ago, we applied for a grant through the legislature to help us build detox. And we did get that. Our grant was for $750,000. We really wanted it to just buy the property so we could start down the path, because we knew it was going to be a multi-level thing. And are people seeing my screen? Okay.
Yes, we can see it.
Yes.
Okay. Sorry, I looked up at the YouTube one and the YouTube one didn't look like it was sharing. I'll keep putting my eyes on this one. But as we're doing this, we're finding some barriers to building a detox and inpatient, and specifically around reimbursement. So I wanted to share for you guys to see that, because I don't think people understand how there is not parity when it comes to reimbursement between mental health and substance use. And I've known this for the last 21 years, but it's really becoming a spotlight now. So just a little bit of background. In February of 2019, we requested $750,000 to purchase property to build a detox inpatient facility. In approximately April of 2019, we were awarded that request. And by the summer, we got all the paperwork, got everything done, and we started down the process of doing this. So we started beginning trying to secure grants and other resources, because we anticipated building a new building to house both was going to cost up to $10 million. And as we're doing that, we were also really looking at reimbursement rates, because we knew we were moving from a BHO system to an MCO system. So that was going to change up some stuff. And we found that there was a large discrepancy. I reached out to a lot of my counterparts that already run inpatient facilities, and there's a lot of discrepancies. So I'm going to kind of just give you one snapshot of what we're coming up against. So in 2019, we, Cascade proper, we placed 4 clients into detox only. 6 clients we placed into detox and inpatient, but we actually placed 32 clients into inpatient. And then an additional 15 of those clients aborted the process. And they aborted the process because it was taking too long to find a bed. It takes a minimum of 14 days to get somebody into a bed. And I know that the state has a philosophy of treatment now, and that doesn't coincide with treatment now. We're one of 3 adult outpatient agencies that provide SUD. So it's good to estimate that we were a third of the total number of clients that needed placement. So what I did is I added that up. That's 141 clients for our best guesstimate that needed inpatient services in Lewis County. That equates to 4,230 bed days for those clients. So here's where it gets tricky, the bed rate discrepancies. So if you compare an SUD residential to a mental health crisis stabilization unit, mental health crisis stabilization, they get $382.33 per day. SUD only gets $183.36 plus an $11.64 room and board. So that's what the current rates are listed on the HCA fee schedule. However, Matt Patton and I did a lot of research and called some different MCOs. And they, of course, you have to go into negotiation, but they were pretty proud of themselves that they increase those payments between 15 to 20% for SUD, but that still leaves us $100 short of being parity to mental health, which is not good. So if we would have built at the mental health reimbursement rate for those 4,230 days, we would have been paid $1,617,255. But the SUD reimbursement, we only would have got paid $824,850. That is a difference of almost $793,000. That's a 51% less reimbursement rate to mental health. Our staffing levels are not different. We have to provide the same amount of staffing levels for an SUD residential as a mental health crisis stabilization. Also, starting in January of 2021, we are going to be required to provide MAT services, medication-assisted therapies, whether we provide them in-house or we make sure we spend the time to refer them out and also take them back and forth to those appointments, whatever that is. So there's going to be a lot of administrative overhead that's going to happen with this. So why is the difference? Why is SUD paid 51% less? We've talked about parity. I can tell you we've been talking about parity in this business since 2005 when I came in. We're not seeing parity between mental health. We also know that we have an opioid use crisis. Again, I'm getting on my soapbox and saying we have a drug crisis. This is the same thing that happened when we did the whole meth initiative. We hit meth hard. Opioid came in behind us and snuck up on us. We have other drugs now coming in and sneaking up on us again. Meth is on the rise. Cocaine, I'm surprised to see how much cocaine's on the rise. We know that there's an issue with THC, especially since they made it legal. So we have a huge drug crisis. And we need to be able to provide the full continuum of care, which includes residential treatment. And it's going to be difficult to increase our bed availability under the current reimbursement rates for SUD. So here's my heartfelt ask. Please consider looking at why we are funding SUD 51% less than mental health. We know, we all talk about this. We know that both are sorely needed, and we understand that there are special needs for both populations. We need to have the specialized treatment for both of them. So we need to make sure that they are getting the same quality and quantity that those clients deserve. They deserve to have the services that they need. And it only is going to improve our community and their lives. So please, please consider this. And that is what I have for my presentation. So if you have any questions, please ask.
Thank you, Minnie. Does anybody have any questions? Any of our distinguished panel have any questions for Mindy?
Oh.
I was just going to say, this is Commissioner Fund, that this is a longstanding problem in terms of reimbursement for dollars, that SUD always has been like the stepchild, so to speak, in getting dollars. So I think it's time that we reduce that stepchild and make it parity. Thank you.
Ed Orcutt's up too.
So I don't know how much you followed it, but living down here in Kalama, I got all of the Oregon political ads. So I was constantly hearing about Measure 110, which decriminalized drugs. And I'm starting to get emails from people requesting that we do something similar here. I know that we already do drug court, and so that we have a way of keeping people out of jail and out of the prison system if they go through treatment. What little I've heard, you know, other than what the proponent said, was that there's nothing in Measure 110 that mandates somebody go get treatment. So I'm wondering how familiar you are with what was passed down there, and what your reaction would be if people were trying to pass that in Washington.
So for this, I'm going to state my own personal opinion of 21 years in the business. And I will let Richard jump in to say as an agency. One of the things that scares me, and I've shared this before at this, when we started giving out Narcan, please do not take this as I want anybody to overdose or die or anything like that. But I will tell you, as a treatment provider, treating somebody who is not afraid to die becomes very difficult. It is not uncommon for us now to have clients who come in and tell us that they've been hit 5, 6, 7 times with Narcan. And I'm not talking about at that one time, because we know sometimes it takes multiple doses. I'm talking about they've almost overdosed 6, 7, or 8 times, but they're not afraid to stop using because of that. That's very difficult to treat somebody. So I struggle with making risky behaviors safe and okay. I am an abstinence-based counselor. However, I do know that we do harm reduction leading to abstinence-based. So that's why I like MAT treatment. But I guess that's the best way I can answer your question. It's very difficult for those of us who are in the business that are watching these kind of things come down. I know that there's a lot of proponents for prevention and harm reduction, but it's hard for us who are actually treating the clients.
Thank you, Mindy. I really don't have anything to add to that, other than I know this is a concern. It's an issue, and we will be working closely with our SUD program here, also working with our local legislators and governmental officials to kind of navigate this as it presents itself. So I don't think at this point we really have any hard and fast rule about how we're going to deal with this. But certainly it's definitely on our radar, and it is frightful. It's a difficult time, I think, for all of us to kind of work through all of this. So thank you, Representative Orkoff, for bringing that up. Any other questions for Mindy?
Hey, Mindy, this is Rob Snaza. First of all, thank you for your commitment and dedication to what you are doing. It is truly appreciated. And I want to be on
Unmuted.
Mindy bandwagon because I want to tell you, with Representative Orcutt, and I understand you get these requests all the time, all I would tell you is when you want to legalize some of these drugs that Oregon has done, all I'd ask you to do is drive through downtown Portland or downtown Seattle. And if that's how you want, how I look at it as Lewis County looking, I'm not there. And we face enough. And I wish that individuals who are looking at doing this, want to legalize this type of activity, would really take a trip down with law enforcement or with mental health professionals as they go and see these people who are actually under the influence or going through crisis or out on the streets, because it's not just going out once or twice, but I guarantee you, if you went out with law enforcement or mental health or Cascade on a number of times, more than just a couple days, you would try to understand and see what we see and realize that there is a holistic approach, and the MAT program is working, Medical Assisted Treatment Program is working in our facility. And it is working through Lewis County. And again, I'll reiterate that Lewis County, with working with Cascade, is some of the leaders in what we're doing with mental health and drug addiction. And I wish others would take note as to what we're actually doing here. So Mindy, again, thank you for all your work and your team's efforts on the SUD program.
You're welcome. And, you know, we do have 2 SUD professionals in the jail with the mental health professionals. And I will say, shout out to you, Sheriff Snaza and Chief Sweet, because you guys worked so awesome with us. When we had to go into isolation, we did all of our services over the Kite system. So we were still having a lot of contact with everybody that was in the jail. We monitor the release calendar every single day. So whoever's been released that we've talked to over the Kite system, we call them, we get them into treatment. I mean, there is a lot of things that we're doing to get people in treatment. But as Sheriff Snaza said, you know, sometimes the first time that we have contact doesn't get them in, but we can't give up. We have to continue to reach out to them, continue working with them. Make sure that they know that when they walk through my door for treatment, I'm not judging them. It's come in for treatment. I'd rather you come in for treatment than not. So, and whatever we need to do, if we need to send you to inpatient, because let me tell you what, in the state of Washington, all of our detox inpatient, whether it be short-term, long-term, or whatever, and outpatient, we all work together. There is this great network of providers that work very well together. We develop relationships with each other. We know what type of system, because every residential does a little different philosophies, but we know what kind of clients to send to those different ones. And again, I'm going to bring it back to reimbursement. If you reimburse us better and at a proper rate, the same that you do for mental health, you're going to see the quality and quantity of these services increase. It's going to just enhance what we're doing. So again, I please ask that we really look at that in this next legislative session, because it's also going to enhance the COVID response as we move forward with it.
Thank you, Mindy. Any final questions from any of our panelists? Questions or comments? Okay, thank you so much, Mindy. I appreciate all you do for Cascade. I appreciate all your good work. And Ruth from the Housing Resource Center is going to be coming up next to talk about housing needs in our area. Ruth?
Hi, can you hear me? Can you hear me?
We can hear you, can't see you yet.
Okay, I got to turn that on. There we go. I'm sitting here in my office. I want to respond to the very first question with that was presented what is COVID affecting us? How is it affecting us? I'm Ruth Gutierrez, and I'm with the Housing Resource Center, and I'm the director. I've been doing housing services for probably 28 years of my life. So it's a long time. We have been open throughout the entire time. We've never closed our doors, of course, because we have shelter. We have a family shelter. We have a single women and family shelter. We have a single men shelter. We were dealing a lot with the county in the way when they had the pop-up shelter, doing case management, making sure people were safe, using PPE stuff, the equipment that they had. We actually manipulated our shelter so we didn't actually have to close and people stay there all day. We are a low barrier shelter, which means that, there's not a lot of barriers to entering our shelter unless you have aggressive abusive behavior and you're abusive to the people that you're there. So we left our doors open. We went out and actually to the community. We have outreach that we were providing tents and tarps so that people could distance themselves, quarantine themselves, make sure that they're safe. We altered our own shelter so that our capacity would be 6 feet head to toe. So we actually lost 6 beds in the total shelter system that we have. But we were able to continue to maintain people who are out in their cars or in tents or wherever there are family or children, to make sure that they stay safe. And that's what we were doing. And we were also maintaining our visits with families and individuals who were finding that they needed help. They didn't know what to do. It was a situation where it's like, everybody's closed. What do I do? Who do I talk to? So we were here the whole time. Our doors were locked, but we met over the phone. We continued to do our coordinated entry assessments over the phone, taking information, commuting from home. There were 4 or 5 of us in the office at all times. We rotated our shifts. We have never closed. We have always been here and our shelters have always been open. And we continue to provide housing, and part of that housing for us means that we do rapid rehousing, which means that we can either pay a short-term subsidy or move-in costs, short-term meaning 3 months, 6 months, or we could just do move-in costs. And with our barriers that we have now within housing, there's no vacancies, and also the moratorium that occurred, people aren't moving. So we have to really be able to negotiate. Our team negotiates with other providers and landlords to, do those incentives as far as helping people move. And through this time of COVID that we've been having, we actually, from January 2020 to December of 2020, just for rapidly rehousing people, we had 302 individuals come through our door. 183 households come through our door, and we actually were able to house 64% of those. So we housed 119 individuals within that period of COVID, which is not too bad when there weren't a lot out there. Mind you, it's not, everybody renting their houses, but rooms for rent or sharing space or doing what they could do to make sure that the environment was safe for them as far as the pandemic is concerned. So we provide HEN here, we do housing and essential needs, we do the majority of rapid rehousing, and the majority of our services are for chronically homeless or individuals living out of doors or living in their cars. It's not homeless, meaning people who are doubling up in families. We don't do that particular service. We rely on other service providers in our community who can provide that. We don't turn people away. We always have an open door policy. It's no wrong door here. So if you come to us looking for something, we are here to help you find that resource. So meaning in that resource is we deal with every aspect of people's lives, and we hopefully direct them to the area where they need to be going in order to either maintain housing or to gain housing and a safe, stable environment for themselves. And that's what our shelter is a safe, stable environment for families and children. We have 3 family rooms, unfortunately. We're looking at trying to expand that so that we can get more families in. And then, you know, we lost the beds, but we fortunately were able to, with some funding from the county, state, and the federal government, kind of gain those beds back, plus be creative and maybe add some beds so that we can actually continue with our low barrier shelter. We're the only low barrier shelter in our community. You know, the pop-up would be a low barrier, not barriers to get in. You can stay in if you're sick or ill. We take service animals. They have to be verified service animals. We're really trying to make sure that these families and individuals are safe and healthy in our pandemic as well as moving forward. My ask would be for our, folks who have the ability to do is to, we got a large flux of shelter money, and, how are we going to house all these people that are, wandering around and don't have a stable place to be, and, potentially being vulnerable to COVID. I want to make sure that that money keeps coming in, and that money keeps flowing so that we can continue to maintain the level of service of housing and shelter that we can right now, and as well as the move-in costs for families, because it has become so difficult to actually get families and individuals into housing that is lacking in our community very much. And I would also ask, let's create a new and better infrastructure so that we can build and provide those things, tiny homes, something like that. So that was quickly, and I talk pretty fast. So please, if you have any questions or anything that I could provide for you, please simply ask.
Do any of our panelists have questions for Ruth?
Ruth, this is Peter Roberno. I have a question.
Sure.
So of the 64% of people who are housed, or that rate, how many people are still housed now? Because, kind of just thinking logically, obviously there's going to be a need for a certain period of time for, a stable budget on this type of respite housing, but it shouldn't stay there. I mean, if we're doing our jobs, then the amount of your budget or everyone's budget should really be going down, because people are then becoming self-sufficient. So what percent of people are still housed?
The percent that we house, not all of those are providing an ongoing subsidy. So okay. Some of those have an ongoing subsidy, some of them don't. I don't have that number in front of me, but Peter, I could most positively email it to you. But out of that 64, I'm pretty sure, because when they come back through the system, they come back through our doors. So okay. That is in that 11-month period that we have housed folks, and we generally check in with folks to make sure that they're okay and what's going on. So as far as I understand, it should be pretty close to the same, maybe down to 50, something like that. But our case managers and our team here really try to do a really thorough job is to make sure that that budget for that family and the self-sustaining ability for them is that they can maintain their own housing. That is our goal, is to maintain housing. We have transitional housing programs, or the rapid rehousing programs, whatever the flavor of the world is right now, the word is up to 2 years. It can be from 3, 6, 9, 8 to 24 months. So what we try and do is do a gradual subsidy with programs that allow us to do that if that family needs that. And that case manager or peer support person is walking right alongside them. So it's like, if we're not getting a job, if we're not getting some education, if we're not doing something, so that job of that case manager is to encourage that person to do what they need to do. We can't tell people what to do, but we can certainly encourage them. So I would hope that the majority of those people are still housed, because I haven't heard, and I'm one of those organization runners person who is very involved in people that are here in this organization, because I started out as a case manager. I started out as running a shelter 28 years ago. So I know and I care about people. So our goal and the thing that I am instilling in people here from my team is we need to make sure that people are self-sufficient, because this money is not going to be here forever. And they're going to have to be able to take care of themselves and their children.
Well, and I appreciate your work, because I know that you hook people up with the area that they need most. So when someone comes in, you identify that need and then you spread them out to that. So I appreciate that. I think that is something we need to do more, I think, globally, is identify the needs so that people can be more self-sufficient. So those budgets naturally go down because people become self-sufficient. So
yeah, I would just hope the budgets don't go down so that we can make sure that they have a starting point, so that we, who are people who are trying to move them forward, and that money to move them into someplace is always there, and have the ability to have access to that money with the least amount of barriers that we can have. But you know, the rules are rules, and my team are rule followers. So it's like we reread the guidelines up and down and one and the other, and we pencil in marks so that we make sure we're doing what we're supposed to be doing. Or if there's a little teeny hole, we can find that hole.
Ruth, one more question quickly, if I can. You know, last year at this, you and I had a discussion about some of the issues that we've had through regulations, through intake. And when you have folks who, you know, are families, or someone who is in recovery versus someone who isn't really following the rules. I mean, are we still having those issues, and are those things that need to be addressed as we move forward?
Well, what I would like to say, and the way to address it is, maybe I spoke to it incorrectly when I was talking to you about it, is the way that I, or maybe misunderstood. What I would like to have is funding for each and every community that you can have two different types. You can have a low barrier shelter that you can have the ability for people to do what they need to do. And you can have another situation where people are in a situation that maybe they're farther along in their recovery. We've kind of, or in their mental health services, we in my organization have we recognize that. So we have some ability to split those populations when we can, and because we try to recognize what we need to recognize. But a low barrier shelter means that, you know, people can do what they need to do and then come back in the shelter, but not ask them to, you know, please just lay down and mind your P's and Q's. But if we have those abilities to have those two different places and actual funding for those two places, because right now that's not happening in our community as well as perhaps it could, because of those constraints with funding. Not because we don't want to, it's because, you know, it's either or. So if we could have the ability to do both, that would be really wonderful.
Yeah, and I think we're on the same page. We're talking about segregating those populations out so that the people in recovery can maintain sobriety and get on that pathway, and you deal with the other populations a little differently.
Correct. Yeah. And that would be great. And, you know, because everybody's got to have a starting place, and we always just have to respect where people are and what they're doing, you know, in every walks of life. So, you know, teach your kids. It's like, you know, you're no better than they are. You just got to respect who they are. I mean, I get it. I got a 17 and a 19-year-old boys. And so that's my mode.
Yeah. God bless you on that. Thanks for.
They're good boys.
Any other questions from our panelists? Well, I just want to thank Ruth and her team. I've had the privilege of being on their board for the last few years, so I see how hard they work as the Housing Resource Center, and I see how hard that their staff works. So thank you, Ruth, for all that you do and all that you do for our clients and for Lewis County clients. I really appreciate it. Next, we have Chris from Hope Alliance.
Okay, good. Can you hear me?
Yes, we can.
Okay, perfect. Thank you. Thank you for having me. I'm Chris Kamenstein, and I'm the Executive Director of Hope Alliance, which used to be known as the Human Response Network. I've been with the agency for almost going on 3 years. I come from a background of domestic violence and sexual assault services, and myself was a victim of domestic violence many years ago, and that's how I became involved in this work. Right, I would like to maybe talk about at the beginning of COVID, we found out that the office that we were housed in sold and we needed to find a new place to move to. So we had to move during COVID, and we found an office in Centralia that is a nice office. It's a little bit smaller than what we would have preferred. And the rent is twice as much. So that's eaten away a little bit at our budget. And we've also been unable to have our big fundraiser, the golf tournament. So on top of the rent increase, we've been unable to raise the amount of money that we rely on. Lewis County is an amazingly generous county. I could not believe when I first started the amount of donations that we received, financial donations. I believe we received around $95,000 last year. But I'd like to go back now to something called a one-day count. And it's with the National Network to End Domestic Violence and the Washington State Coalition Against Domestic Violence, which I served on the board for 6 years. This was the first time that, at the time, Human Response Network participated in. And it's a 24-hour count where we count how many clients we serve in a 24-hour period. And that is just solely based on domestic violence. So that is not including our sexual assault clients. So last year on September 12th, we served 15 shelter residents, 6 women and 9 children. And we normally have a stay of 90 days in our shelter. We do not kick somebody out if they are still going to be homeless or if they're on a path and about to get their home. We show some grace. But on that same day, we had 58 walk-ins to our office looking for services. 40 of those were adults and 18 were children. So it could have been, we would have counted an 18-year-old maybe coming in for services as a child. It could also have been adult with children in tow. So for that one day, we served 73 domestic violence clients within a 24-hour period, which I think is really pretty remarkable. I don't know if everybody is aware, but Lewis County does have the highest child sexual assault per capita in the state of Washington. And that's not really a number to be proud of, but once COVID hit, we were really in the process of creating some collaboration with systems to help support our clients or those who we say, please call 911. So that's kind of come to a halt because of COVID, but we're still moving forward, hoping to build partnerships and collaboration and offer training to those in the community. Let's see. Right now we are not taking walk-ins. However, if somebody does come to the door who looks like they're in an emergency, we let them in, and we are practicing safety by masks, the 6-foot rule. We do offer to meet people out in the community if need be. But I would say in general, our numbers are not as high as we know they should be. And I think a lot of it is due to access to phone. People afraid to leave because of the financial constraints, the homeschool. We're not as busy as we should be. But we seem to be very busy in the child sexual assault field. We have, I know a couple of weeks ago, we had 6 new sexual assault clients who were children. So I think the one thing I would really like to say, I guess, to the panel and to the community is that we are here we're 24/7. You will always talk to a staff person after hours. And if you are interested in giving us money, we'll take it. One thing that's been very difficult this year is we usually provide Christmas for a lot of our families. And this year we have not received any donations. And I think that's in part because businesses are closed and they're unable to put a gift tag on a tree or a present under the tree that's then forwarded to our office. So that's one feature that we're not going to be providing this winter. And we'd accept gift cards. We'd love to give gift cards out to the families. I think one of the things that we've really noticed an increase are people being hungry. You know, you can go to a food bank once a month. Food is not lasting as long at home because of people having to stay home all day. So that's something that we're also really noticing a trend of hunger. Another exciting thing is Cascade received a large grant for crime victims. Well, maybe I shouldn't talk about that. Maybe they're going to be talking about it. But we've got this great partnership with Cascade that they received a grant where they'll be able to provide free therapy for anybody who is a client of ours. So I guess with that, I don't really have anything else to say other than please reach out and ask for training. If you need help, please call and send us money. That's all I have if there's any questions.
Thank you, Chris. I really appreciate you being here, and we're excited for that program too. And I'm sure Trish will probably talk a little bit more about that program that we're doing with you all. Any questions from our panel? Okay, thank you so much, Chris. I really appreciate you being here. Commissioner Fund, you're up next, and you're going to talk about the Great Rivers ASO.
Yes. So I'm the chair of the Great Rivers Administrative Service Organization, and many of you have heard before about ITAs or Involuntary Treatment Act. And this is not just a Great Rivers issue, it's a statewide issue. And for those who don't know that ITAs are involuntary civil commitments made by the court to provide evaluation and treatment of individuals with a mental or substance abuse disorder who may be very disabled or they pose a danger to themselves or others. And they refuse to get the treatment themselves. And so the court orders it. So this has taken a lot of dollars to do. And on one side, it's really great. We have more facilities coming on board so folks can go to this treatment locally. But it is causing a lot of dollars to be spent for these non-medicated folks. And 30% of the funds that the BHASOs gave or usually have been given over to the managed care organizations. So the ITA costs are really taking over. So we would like a good look at this statewide. We also know that if you have an ITA cost in one county or another, it can vary dramatically. So we would like to see some kind of standardized view of that. So we are, meaning WASAC, is putting together a one-page document that has the map and the amount of ITAs we've had in each county. So that's coming forth. Any questions? Thank you.
Thank you, Edna. Tree from Valley View, you're up next.
Okay, I've unmuted myself. There we go.
Almost there. There we go.
Okay, and I have a couple of slides if those can be shown. So I'll introduce myself while the slides are coming. I'm Dr. Tree Normwell. I'm a licensed clinical psychologist and behavioral health director at Valley View Health Center. We are a federally qualified health center in the, here we go. So if we could go to the, I guess that's, yep. So there we go. So what I'm going to talk about is our integrated program. We have medical, dental, behavioral health, and pharmacy. In this setting, because it's a medical setting, we are referred to as behavioral health, but it's really means mental health services. If we, do I have ability to go to the next slide, or can, there you go, thank you. I just wanted to give you a little snapshot of how many patients we treat and the makeup of patients. So last year we served over 25,000 patients with over 80,000 medical, dental, and behavioral health visits. Most of our patients, as you can see from the slide, have Medicaid or Medicare. We also make sure that we are providing access to care for those who are uninsured and regardless of their ability to pay. The makeup of ethnicity for our patients, you can see, is predominantly white, but the next largest group that we serve is the Hispanic Latinx community. If we can go to the next slide, please. So the way that our program works is that our mental health or behavioral health providers are embedded in the medical team. We're right on site with primary care. We're considered, you know, a part of the medical team. And that is the way that we're introduced to patients. And one of the strengths of that of our model is that it really helps to take away the stigma and breaks down barriers for people that normally wouldn't perhaps feel comfortable getting mental health treatment. And our medical providers are great at, you know, learning how to introduce us. So if they have someone who comes in and is presenting as having depression, they might, you know, make a statement that we have someone on the team that's really good in helping to get those symptoms you're experiencing to lessen. Would you be interested in talking to them? And then we are introduced to the patient. And it's quite often that we hear, you know, people respond after they have started having, you know, behavioral health sessions that they wouldn't have, you know, just gone to get mental health treatment, and how helpful that it's been. The other thing I think that's so important about the, you know, the type of services that we provide as integrated is that, you know, we have, as most of you probably know, little medical clinics in, you know, our rural little towns. So people can go like to Toledo or Onalaska or Winlock and, you know, get medical care and also be able to access mental health treatment. We do focus our treatment on providing services for people that would have what would be referred to as low or moderate mental health symptoms. For those who are, you know, presenting with more severe chronic mental health diagnosis, then we would refer those to community partners such as Cascade. And I will say that, you know, Cascade has been wonderful to work with us on, you know, that partnership. And it's something that, you know, we continue to work on. So in our setting, the treatment team is the primary care provider, the behavioral health provider, and also the consulting psychiatrist. We work with the University of Washington's Department of Psychiatry, and it's someone that we've worked with for several years, and he has become an important part of the team in providing support to our medical providers. One of the things that I'm really proud of that we have done at Valley View is that we really have focused on making sure that our services match our community. So on our behavioral health team, we have two mental health counselors who speak Spanish. So we're able to provide services to our Spanish speaking population. And one of the things that during COVID that we have done is to focus on outreach in the community, specifically to our agricultural and migrant workers. And one of our mental health providers has actually devoted a lot of time in going out to the work sites where he can distribute that information and let them know where they can get COVID testing, how they can access medical treatment and mental health treatment. I think it's so important because I think that COVID has highlighted the healthcare inequities, and this is one way that, we are trying to address that. And I know that this is something, even once we get through COVID, that our team will really be focusing on. So that's my little overview of the services we provide. Regarding how we have been doing our work during COVID, we have been providing remote services. Our demand for services is really high. Valley View overall, like even some of the medical sessions, like your medical appointments are by telehealth, but we do see in-person medical patients. But as far as our mental health treatment, it is 100% right now by telehealth. And we do, face the obstacles of not having connection. So not all patients can do video telehealth. But even with using phone sessions, we have stayed connected with patients. And like I said, we've seen an increase in need for services, and patients definitely more distressed. And we are seeing more with suicidal ideation. I do think that the state responded very well in making sure that we could bill for, phone and telehealth sessions. So it seems like it, all came together fairly quickly and well, and there was no disruption in service. And I think that, we've learned a lot of good lessons during, having, facing a pandemic and providing, healthcare. So I think that's all I have to say. I'm very happy to answer any questions.
Anybody have any questions for Tree?
I have a question in chat.
Thank you very much. Oh, we have a question. Go ahead, sir.
Oh, Sean
we did have a question.
Swope asked, how is it highlighted the iniquities?
I'm sorry, I didn't hear the first part of the question.
Oh, sorry. The question was from Sean Swope, and he asked,
Okay.
how did it highlight the iniquities?
I think that, we have seen some of the different groups in the United States get hit harder. One is the Hispanic, Latinx communities. And some of it is because of access to care and, perhaps not knowing how they can access care or concerns for going and actually having an appointment. So that's the what we have noticed anyway.
Thank you.
Any other questions for Tree? Tree, thank you for being here today. Thank you for the partnership we have with you, and we really appreciate the collaborative work that we do together, and Valley View is an important part of what we do together to serve our clients, so thank you. Mm-hmm. Next up, we have Andrea from Twin Transit.
Hey, can you guys hear me okay?
Yes.
Yes, we can.
All right, excellent. You always gotta love the whole digital thing here. So I have a couple of slides that I would like to share. If I can pull these up real quick. Hold on one second. All right, can everybody see my screen okay?
It's fine here.
Yes.
Okay, great. So as Richard said, my name is Andrea Coletto and I am with Twin Transit. And I just wanted to talk a little bit. I know that, some of you may be thinking, well, what does transit have to do with mental health? They're just the ones that have the buses that go around in circles all day long. But there's a lot more to it than that. Transit is really, public transit, sorry, I've got to move my thing out of the way here. A strong public transit system is the key that opens the door to opportunity. Through it, individuals can access employment, educational opportunities, and quality medical care, all essential steps to a better life. And I know that nobody knows that more than everyone that's here on the call. I know we've all had a lot of discussions around this over the last year or so. In fact, that's really what we've dedicated most of our time to, was just having discussions with our community partners. We've reached out, we've had these conversations through Lewis County Community Services Coalition. We've had all these cool programs that have come out of those conversations, going out and delivering senior meals during the COVID-19 pandemic. We've partnered with Rotary and other service organizations to do mini gardens and other really great community service pieces. And we've partnered with our school districts for student bus pass programs and to make sure that kids that are homeless or that are experiencing housing insecurity have a way to get to school safely and to wherever else they need to go. These conversations have been really kind of altering as far as the way that transit operates. One of the most exciting ones was conversations that we've been having through the county that led to this bulk bus pass buying program. It's kind of a mouthful, but basically what it looks like on the ground is that all of the different service organizations, many of whom are on the call, can get together and buy passes in bulk, which makes their budget go a lot farther. And it gives them the opportunity to disperse those. Previously, there had been this system about how, people would come into the agency. They'd say, hey, I need to come in for treatment. They'd say, okay, great. Well, can you get here? No, we can't. Well, here's a voucher. Go get your bus pass. Then you can come back. And it was just this kind of really circuitous way of getting service that put barriers in between people and the service that they needed. So now with our new program, agencies can give people a bus pass instantaneously on their phone, or they can have them right there to hand over, when we're not during COVID times. It's been really phenomenal to partner in those ways. And through those conversations and throughout all the conversations, I guess, the question has been, how can we help? How can we make things better? And I would say the conversations we've been having with our healthcare partners like Cascade Community Healthcare and Valley View, this has been more pointed than ever. We all know that transportation is really key to getting good healthcare, but it wasn't as clear to me previous to those conversations as it became afterward. You know, we heard stories about people who needed mental health care treatment, wanted that treatment, but because they didn't have access to a reliable vehicle, they just didn't get it. And they got worse, and there were repercussions to that. We've all been talking about suicide rates and, you know, family impacts and abuse. Access to care is essential. When you have good access to care, you have less missed appointments, less relapse when it comes to substance use, and less reincarceration. That was one that really shocked me is, you know, we'd hear these stories. I was sitting about a year ago with Mindy over there at the office, and she was telling us stories about how, you know, they'd get these clients that would come in for court mandated treatment, and they would show up and they would do the work and they were committed. And then one day their ride wouldn't show up, and they'd be calling on the phone and they'd be panicked. They'd say, what do I do? You know, and because they couldn't turn up, that went on their record. And it would mean that sometimes they'd have to go back to jail. And that should just never be the case. You know, we can do better than that. We've also learned that people that live with mental illness have additional barriers, oftentimes in using public transit or other systems. You know, sometimes they don't even have access to a public transit zone. They may live on the outskirts of town, or they may live, you know, in a more rural area. And sometimes they can have difficulty understanding the system or coping with crowds or some of the things that come along with public transit. And that's why we introduced this Dial-A-Ride Twin Transit program. It's kind of a mouthful, but we're really excited to roll it out. So this is the result of all those conversations, all of the need that we've seen in the community to get people where they need to go in the quickest and most effective way possible. And really, it's born out of those conversations we had with Mindy and the Cascade team. How do we help people get the treatment that they need in the quickest way possible? So Dial-A-Ride Twin Transit is basically just a door-to-door direct service. It's just exactly what it sounds like. People call 24 hours in advance. They say, hey, I've got a doctor's appointment I need to get to. I've got a counseling appointment, or I've got substance use group, or hey, I just need to go down to the clubhouse and be around some of my peers and my mentors and just be in that space for a little while. We'll show up, pick them up, take them down there. It's easy, and it's very user-friendly and very not intimidating. Right now, our radius is just a 15-mile drive time radius around the Twin Cities, but we'd love to see that grow in the future and be able to serve more of our rural neighbors in that way. Not only is it great for those that are living with mental health issues or with substance use issues, it's really great for our senior population. We ran into so many seniors when we were doing senior meal delivery that they just, you know, they wanted to age in their homes, but then they lost the ability to drive and they became isolated. And that doesn't need to be the case. You know, they shouldn't have to just depend on friends or family members to take them where they need to go. This program gives them that independence back again. The same is true for our youth, you know, for our teenagers or young people that need to go places, people that are socioeconomically disadvantaged, or anybody that just needs a ride. I mean, we've all been in that place, right? You just need a ride somewhere. And it complements our fixed route and our Lyft systems really nicely too. Part of this, what I'll get to in the next slide, is this concept we have about collect and connect. So ideally, our goal here is to collect people up and connect them to the services that they need. The tricky bit about living here in Lewis County is that a lot of the things that we need are pretty spread out. Either people live far out in the rural areas, or we need to get up to Olympia or down south, and it's just not always that easy. But we think we have a system that will help solve that for a lot of people, particularly the people that really need those services. That's where our focus is. So with the Collect and Connect system, we've got our DART system that goes out and gets people right from their homes. We've got our Bain route system in town. And then we've got our Lyft system, which is for people with mobility concern. So once we can get people collected up, we can connect them through a rapid transit route. So we've got the Rapid Hub already that runs between Centralia and Chehalis. But we're really excited that we're going to be able to introduce a new rapid connector that goes from Centralia up to Tumwater, and intercity transit. That will be starting in early 2021. And that's going to be huge for our folks that need to go up there and get access to medical specialists or job opportunities, commuters. And a lot of you have heard us talk before about the whole broken link on the I-5 corridor. So, you know, you can get from Olympia northward and from Kelso Longview southward, but there's no connection in between the two for public transit. This helps solve the first half of that broken link, which is just phenomenally huge for our community and for the folks that need to get access to those services. So the really exciting part about this is it helps serve our community, and it helps people get access to jobs, better access to employment, and especially better access to healthcare. But it also does all of that with renewable energy. So you may have heard that we've got 2 electric buses on the way. Those are being retrofitted right now down in Riverside, California, I believe it is. And they're actually 2004 buses. It's really cool. They just strip them out, put in the new electric technology. I think it's ZEV technologies. And then they're green and ready to go. So 1, it keeps them out of a landfill. And 2, it keeps those, takes 2 diesel buses off the road. And then 3, it retrofits them with this electric technology. So it's kind of a triple whammy that's really beneficial for the community. Those are going to be based out of our new Mellon Street E-Transit station. That's another new green technology project we have coming. So when the time comes, early 2021, we're all kind of keeping an eye on construction with COVID and seeing how everything goes. But if all goes according to plan, early in this spring, we'll see those on the road going up and down to Olympia and back. And so 2 things with that. We're really phenomenally excited that we're going to be able to use these green technologies to better serve our community because it brings new economic development. It helps people access the things that they need. It draws more focus to our area. If you look at people that would like to come invest in our area, having a vibrant and robust clean energy platform is a really big deal. And then, yeah, that's really the key, I think, for that one. So the other thing that we're really excited to talk about, and it's so new, we probably even shouldn't talk about it too much, but I couldn't resist, is that we've actually just been placed on the recommended list for a 2020 Green Transportation Capital Grant, which means we'll be able to put, if all goes according to plan, we'll be able to put a second e-transit station down south, which gets us just that much closer to closing that gap, that broken link, and having transportation access all the way along the I-5 corridor and bringing in commerce and opportunities here to our community, connecting our folks here with better jobs, educational opportunities, and economic development, and better access to medical care. Whether you're in a rural area coming into the Twin Cities or whether you need to access a specialist outside of the Twin Cities. So that's where a lot of our focus is going to be, is how do we continue to use clean energies moving forward to help our community in this way. We even kind of formed this, we're calling it the LC-REC. It's a Lewis County Renewable Energy Coalition. And that's the whole aim, is how do we bring clean energy technology into our community in a way that serves our community and makes us stronger. So just to close up, this is something we've been thinking about and talking about a lot over the last year, is just this synergy of how you can do, one right thing, and it just yields so many positive results that pretty soon everything's working in tandem in a really positive direction. So, we need just increased connectivity through transportation. And when we've got the community collaboration piece where all these agencies are working together and all kind of, with the same goal in mind, and then you add in this clean energy implementation, you get this really cool kind of, just synergistic positive outcome where you're getting better healthcare results, improved access, better education, employment, and then you've got this clean energy economic revitalization. So just good things happening on all fronts. And I would just say thank you for all of your efforts in funding our local partners and the people that provide healthcare and services to those in need down here. And keep it up, and we'll keep doing our best to get them where they need to go. Any questions?
Thank you, Andrea. Do you have any questions for Andrea?
Richard, this is Mindy. I do. Can you hear me, Andrea?
I can. Hey, Mindy.
Okay. Hi. So it's more of a question comment. So you did share that me and you have been talking over the last year and a half. And I just want everybody to know, and any of the legislatures that are still on, this has been a huge response to my issues. I'm going to not be politically correct, and I'm going to just put it out there. Paratransit fails to bring our clients to treatment a lot. And unfortunately, the courts don't care. And I have had clients get sanctioned and put in jail because they were in non-compliance of their treatment. So thank you, Andrea, for listening to everything that I was saying and helping me. And I'm excited about this because this is not only going to help with their treatment, but the problem is they're required to do 12-step meetings, and paratransit won't take them to that because it's not medically necessary, but it's part of their medical treatment. So this is going to help. So again, thank you, thank you, thank you.
Yeah, thank you, Mindy. Your input has been absolutely invaluable on this. It's funny, we actually, throughout the process of this last year, we ended up going after a grant to help fund this program. And then halfway in, as we applied for the grant kept getting bumped back because of COVID and, just the uncertainty around that. And eventually we just said, we just got to do it. We can't wait even one more day. There's no more time. We have to get this done. And so we ended up launching it. I think it was on the 16th of November. It's up and running now. Just because the stories and what all you folks are dealing with on the ground, there has to be a better way for people to access your services. And that's where our passion lies. Yeah, thank you, Mindy. I appreciate it. Oh, and just to clarify too, just because I think it's pertinent, so there's the state paratransit, and then there's our little local paratransit, which we actually just rebranded Lyft because there was, some confusion, and we wanted to make sure that we weren't associated with the one where the confusion was happening. So now we have our medically assisted ADA only Lyft program, and then now we have DART, that's the door-to-door transportation services. So hopefully between the two, we can help a lot with that. Any other questions?
This is Representative Orcutt. Regarding the deployment of DART, I have two questions. One is, how are you staying COVID compliant? Are you having the passengers ride in the back seat on the passenger side to try and maximize distancing? And then the other thing is, I know some clients will have children. Some can be very, very young children. Are you also providing booster seats, other child safety seats to accommodate the children that they may have to be bringing along?
Excellent questions. Thank you so much. So in regards to COVID, yes, we are following really strict protocols with that. So with all of our equipment, we do full sterilization every night. This is no different. We've installed plexiglass shields in between the drivers and the passengers, limited to 2 passengers or 1 family group, just to keep exposures at a minimum. Masking is required. All those usual things that we're kind of all accustomed to hearing around, plus quite a few extras. So we are taking it very seriously, particularly because, this program, it really is ideal for some of our older folks. And so it's essential that we go above and beyond to make sure that they're safe. So excellent question. Yes, we're taking the COVID precautions very seriously. And that's how we're going about that. Someday in the future, when we're all back to normal again, we'll be able to say, hey, everybody, come on down. We'll take you all at once. But for now, it's a pretty small crowd.
And then the second question was about whether or not you're providing child safety seats so that when you go to pick somebody up, they're not having to try and figure out how to fasten theirs into your vehicle.
Yeah, that's an excellent question. So this is one of those things about a new program. We're just getting up and running, right? So far, we haven't had any issues. It seems like people just have their own equipment ready to go. But if we, that's something I could see us really wanting to introduce as we move forward. So that's something I'll take back and talk to the team about and say, hey, do we just need to have some equipment on hand so it's easy and ready? I think it's a great suggestion. Any other questions?
I had one from chat. I had a question, Andrea, are any destinations okay for these programs, and are they available for anyone in the county?
Excellent question. So the DART program operates within a 15-mile drive time radius of the Twin Cities. We have a map. If anyone has questions about exactly where that looks like, just let me know and I can help you get access to that. So it's not open countywide. We would love for it to be at some point, but right now it really needs to be kind of centered around our region, around the Twin Cities. And so we've, part of the reason for that, if I could just delve in a little bit, just quickly, was, in our conversations with a lot of our health partners, our healthcare partners, they talked about this effect where you have kind of the people most in need tend to be on the outskirts of town or just outside of it, where it's a little more affordable to live. And so, we've got our fixed route service right here in town, which is fantastic. But if you're not within that area, it's not very helpful. So this is all about helping the people just outside access that. And we would love, as we get more grant funding and as we have, better partnership opportunities, maybe we could look at, taking Medicare or Medicaid or other payment options, being able to expand that window. But as of right now, that's kind of why we landed in that area. Did that answer the question?
Yes, thank you.
Okay.
I think Trish has a question as well.
I don't have a question. I have a comment. I just want to kind of say kudos to Twin Transit. I know Andrea also has really formulated a community group during COVID. I'm sure other people were involved in that, but the Lewis County Coalition meeting and the great work in bringing people in the county together to really be able to come together and problem solve concerns around COVID and also around transportation has been about just anything that comes into play. And it's been wonderful. And it's so nice to have, because people don't understand how much transportation really plays into mental health services and the need there. These are people that oftentimes cannot afford their own car. And in a rural area, they don't have a bus system that necessarily is as easy to access. And so you guys have done so wonderful at transforming and hearing the needs and providing those needs and working with us. So for everybody in the community, thank you for everything you guys do.
Thanks, Trish. And likewise, you and your team are phenomenal. Like we wouldn't have been able to do any of it without you guys and your input, and so many of you on this call.
Thank you, Andrea. I really appreciate you being here, and just kind of piggyback on what Trish was saying. Andrea, since you've been at Twin Transit, you've reached out to us, you've partnered with us, and you have a real heart for the community and for the people that we serve. So thank you. Thank you very much for the work that you do.
Thanks, Richard. Likewise.
And we also have, I want to pause for a second and recognize Representative Jim Walsh. He's on our call from the 19th Legislative District. And Representative Walsh, I don't know if you want to say anything about, we usually give our panelists a couple of minutes to talk about what's on their radar for this next legislative session. And if you'd like to say something, we would certainly be happy to have you do that if you would like.
I don't actually see him on the Zoom meeting.
Okay. He's probably listening on YouTube. So, all right. Well, thank you for being a part of this, Representative Walsh. Really appreciate you being here. Next up is JP Anderson from Lewis County Social Services and Health. And just let everybody know, Cascade raised JP. JP was a part of our team at Cascade, and he kind of cut his teeth on social services here. So we're really proud of to say that. I say it all the time for JP. So JP, thank you for being here. Take it away.
Thanks for having me, Richard. And it is always nice to return to my alma mater, even digitally. This year notwithstanding, I coming into work today, kind of driving through fog and thinking about today's conversation and all the things. It was kind of a really nice retrospective just to think about my career and so much of it being with you guys at Cascade, and hope you're all well. It's really a pleasure to be here today alongside so many of the caretakers and the people in Lewis County who are working to serve humans, to serve people that are here. And, you know, I think about it, I get to think about it really broadly now in public health and social services, and have a role with so many of the different facets of this, and our team does. And as everyone knows that works with our department, we truly are a team. And I hope that everyone finds that our team members who are working alongside them are empowered, are able to be proactive, make decisions, get things done, and be a representation of a government that is functional, that is collaborative, that solves problems. And it's just really a pleasure to think about the group of people that we're a part of in Lewis County to overcome these challenges we have. I feel really hopeful. As far as legislative agenda, you know, I think that, you know, WASAC, Public Health, WASALFO, the state lobbying organizations are going to do a fine job of talking about the legislative cliff, the funding cliff, excuse me, that local health jurisdictions are facing. I would say that probably our department is in a bit of a better situation, I think, than some others, in that we were able to reserve spending much of the emergency allocation we received at the beginning of COVID. And so as things are worked out and the plan for whatever comes next is being worked out, I'm confident we'll be able to maintain our level of service and our COVID response. So I'm happy to report that, but know obviously that there will be a lot of discussion around that. There's a lot of needs that counties are facing, ours as well. And always happy to answer questions about that and how we're using those funds. Always wanting to use those to the best benefit of the community. With our most of our funds of the CARES Act, you know, that's been outside our department and in the community. The behavioral health impacts of COVID can't be overstated, I don't think. I think that at the beginning of the event, honestly, I was one of the first voices, I think, for looking at what are the impacts to the social determinants of health around lockdowns, and not necessarily as an antagonist to them, but just to make sure that that was being something that was considered. I think for our community, they had an even greater impact because of the geographic barriers that Andrea, you know, highlighted, because of the economic barriers that many of our residents face. And so I think that that's going to continue to be something that our department is focused on. It's, I would say, for myself and Dr. Wood, probably the driving factor in going out on a bit of a limb and working to find a path forward for schools to go in person. I have 3 sons in elementary school, and personally seeing what was happening to their health and well-being, socially and emotionally, and just the fear that was building up as they were preparing to go back into the world, and knowing that school really has a place in kind of educating students on what's happened, what that response was all about, and in starting that return to normalcy. I think that we found we can safely restart schools for in-person when we follow the best practices and we hunt for those. And then we develop plans and work closely with schools to do that. It's a challenge. It requires us to have staff dedicated every day. Whenever there's a positive case, we're going to be working closely with them to sort through that, make recommendations, and work closely with the districts and the schools to make decisions on what needs to happen next. But I think it's one of those regulated spaces that we can support in reopening. And so happy to see that that's happening more broadly. And I cannot thank the organization IPAC, Infection Prevention Antimicrobial Consultant. It's a local organization led by some phenomenal women who have just done an amazing job of connecting with schools in a strengths-based approach, working to put together interventions and strategies for keeping kids safe and being able to return to school. On the front of housing, really exciting to hear the discussions earlier, and in particular, the conversations around, you know, you can think of kind of a multi-tier or care continuum, where you think about kind of low barrier services moving towards services that probably have more requirements, more benefit, and are kind of more closely resembling life independently, which is where we're hoping to help people and support people to get to. I think that a lot of those strategies are going to be something that we can talk about using local document recording fees. Many of the funds, as people know, and we discussed, that come from the Department of Commerce and are allocated by the state are very strictly tied to specific interventions. And I do believe that those interventions are helpful as a part of our approach. But I really do look forward to this coming year, getting back to some of those conversations we were having in March around housing and looking at how we can build the exits from those low barrier shelter situations, the exits from that coordinated entry that we all want to have be functional, and into those sustainable opportunities for people for housing. So lots of discussion yet to come on that, and a lot of work to be done. But I'm really hopeful that we've got some great buy-in right now. We have elected leaders talking about it, supporting it. We've looked at it, we've kind of gone through some of the storming and norming as a system to look at this. And I think we're moving into an action phase. And I think we're well poised to do that. Mija Hanlon, who leads our social services team, who has led our efforts in housing for the last 2 years, has done a phenomenal job. And somebody who, when I think about our role as a government agency and supporting agencies such as the ones talking today, I think really shares that value of wanting to see government be functional, be solutions focused, and has continued to grow and develop a team of social work contract coordinators and community outreach workers that really have bought into that. And I'm really hopeful about where we're going, as challenging as this year's been. Overall this year, I guess I would just take a moment to acknowledge that, we've all experienced trauma as a community, and that's happened across the state and across the country and across the world. And so just like we give advice to other people in our lives or clients who have experienced trauma, to give yourself a bit of space and care, to provide some grace to those around you when possible. I know I've needed it more than once this year. But I guess just to acknowledge that we've been through a hard time when we think about community wellness. This is really a profoundly impacting event that we've gone through, and we need to recover from. And we're going to do that by, talking like we are right now, and by finding our common ground and going forward. There's no place I'd rather be doing this work. There's no community I feel like has a better opportunity right now to take the ball and move it down the field as far as population health. Of course, there's a lot of funding issues connected to that, but I'm also been getting more and more interested in the things that we can do through choice, through decisions that people make to be healthier. I think that a lot of the times it comes down to that. And obviously there's a lot of complicated issues around that thought process, especially around substance abuse. Where does choice fall into that? But I also think sometimes we forget about the choices around just great nutrition for kids, or the things that Twin Transit's talking about, just making sure people can get to the services that already exist. And so when I think of our work in community wellness broadly going forward, and how we can align with our legislative partners, I really think about what are the things we can do now and steps we can take to help people make healthy choices. And I'm just really excited to be a part of that. So it's definitely been a challenging year in our building, as it has been in every building in Lewis County. But I just appreciate everyone for their support and understanding as we've gone through this process. And we still have some ways to go, but I'm hopeful that we're on the path forward. And this time next year, we'll have all taken a big collective sigh of relief. And thanks for the time today.
Thank you, JP. Really appreciate you being here, and thank you for your partnership with Cascade. It's always a privilege to work with you. I want to recognize also a newly elected commissioner for Lewis County, Sean Swoop, and Debbie Campbell and I had the opportunity to sit down and talked with Commissioner Swoop for coffee a couple of weeks ago. And we wanted to tell him about our legislative and governmental forum, kind of what it was about. And so it was a privilege to sit down and just speak with him and kind of give him an idea as to what we're doing here. So thank you for being here, Commissioner Swoop. Appreciate it very much. Dr. Kevin Caserta from Providence is up next. Dr. Caserta.
Thank you. My name is Kevin Caserta. I'm blessed to serve as the Chief Medical Officer for Providence Centralia and Providence St. Peter Hospital, as well as the Site Administrator at Providence Centralia Hospital. And first of all, I just want to thank our panel and for our community partners, how together we really do a great job of making this county healthier. And I think we would all agree that without good mental health, without good physical health, and without good economic health, you can't have just one of those, right? You need all three for our community. I do want to just very briefly update about COVID-19 and where we're at, because I think it is very important for leadership to hear. We are seeing for us in Southwest, so that's Centralia, with many of our sicker patients going to St. Peter, a significant continued rise in COVID-19 volumes. In fact, the last few days, we were pushing right around 40 patients, which is by far our highest numbers. Have now decreased the amount of elective procedures we've done to St. Peter. They need to do even further action moving forward in the near future, so that way we can of the COVID-19 population. The other thing I want to reiterate is, just like our community partners, we are seeing the psychological effects of COVID-19 on our community in terms of the number of people who present to emergency department with behavioral health concerns, with deaths of despair, so suicides, as well as overdoses that they've had, which we believe in part has been flared by this virus and this pandemic. I also want to let you know about what we know is fact. As you can imagine, we get the patients with COVID-19 presenting to our emergency department, often unknown of their status. And to the best of my knowledge, when we utilize the appropriate precautions, the masking, other equipment that we utilize, hand hygiene and social distancing, we have not had one of our caregivers actually infected with COVID-19 when we did the appropriate measures. And so my ask as leaders in the county that you encourage our community to mask, to social distance, to avoid gatherings at this time, to use the hand hygiene, so that way we can have economic health, we can have improve our mental health, and we can have physical health as well. I do want to talk a little bit outside of COVID-19 as well. It's some of the challenges that we are facing as a hospital that also impacts the rest of the community. And that is still an ongoing need for people with the most extreme behavioral health challenges. I'll describe just a couple situations that we've had recently. We essentially had a very vulnerable woman, psychosis, dementia, dropped off at our hospital as her caregivers were unable to continue to care for her, who unfortunately became quite violent on multiple occasions. At one point actually tore down a plexiglass barrier between herself and other caregivers, assaulted multiple caregivers, and ultimately police were called, was then sent to our emergency department again, where she stayed for a long period of time, and ultimately transferred to St. Peter, where she still remains without a long-term destination of care. In addition, we had a patient with extremely violent history, psychotic, brought to the emergency department, very experienced, very hardened ED providers and caregivers were afraid to take care of this gentleman because of the extreme nature of his behavior. Eventually, he was brought to jail and then ultimately was taken out of jail by EMS and then taken to Providence Centralia Hospital. You can imagine moral distress of our caregivers when they work threatened and hit seriously injured by patients. So when I look at this problem, and this situation is just a microcosm of what we're seeing now, my ask is that we get together as leaders in this community. I'm happy to help to lead work in a task force that really will look at solutions, creative solutions, or what do we do with people with dementia and behavioral disturbances? We have no good place right now, or very limited in Washington State. What do we do for patients, people who have violent tendencies associated with mental health problems? They really are some of the most vulnerable patients that we care for. So they do need excellent care. Again, they also need caregivers throughout Providence as well as all their partners as well. And so my ask is you do a little bit more of the surge and come together and work creatively on solutions. I thank you for the partnership. Very much entertained.
Thank you, Dr. Caserta. And just a shout out to you and your team. I've called Dr. Caserta, I've emailed him, and he's always very responsive. One of the kindest, most gentle people that I know. So thank you, Dr. Caserta, for your friendship to Cascade, for work with our clients, and I just want you to know how much we appreciate you.
Well, thank you. And I am blessed with the phenomenal team at Providence and then this expanded team.
Up next, we have Sarah from the Youth Advocacy Center. Oh, I'm sorry, Samantha.
Am I on? Can you hear me?
We can hear you.
Yep.
Thanks. Well, I will make this short. It's been a strange year for everyone, and it's been quite a horrific year for our kids, and especially the kids that have come through the Youth Advocacy Center. I'll briefly tell you what we do. I'm kind of a one-woman show over here. We get children, we're trying to have wraparound services. So when there is allegations of child abuse made to CPS or law enforcement, those families are sent here for a forensic interview, which is a legally defensible interview that's recorded about allegations of abuse that may or may not have happened, like sexual abuse, physical abuse, neglect, maltreatment, child sex trafficking. If a child's a witness to a crime, anything involving criminal allegations and a child's involved. The non-offending family and child come here, and I do that interview. That interview is provided to law enforcement and only law enforcement as a part of their larger investigation. But at that point, we can provide family ongoing services. We partner with Hope Alliance, and Chris and her team provide the advocates for the family while they're here for the interview. We have on-site sexual assault exams that we have for the kids that come through here as well. We have the ability to offer a lot more on-site services, but right now we are just partnering with as many agencies as we can to get these family services off-site and making off-site referrals. Our numbers are up from last year. I also do training for the community around how to recognize, respond, and react to child abuse, and that's free. I also do a number of other trainings and have gone to quite a few organizations throughout Lewis County and really just tailored any training around child abuse that they want to do for them. Like I was saying, our numbers are up from last year. When we hit March, we were up 41%. And then we went into lockdown and those numbers tailored off. But so far, we're still ahead from where we were last year. Last year, I interviewed 103 children. Right now, I am up to 112 children. And the month's not over. So I'm assuming a few more referrals will come through. Of those 112 children, 247 types of abuse were recognized during these interviews. So regardless if they came in for one, that's, if they come in for one more often than not, more types of abuse are recognized. We had 75 referrals for child sexual assault exams. They started off being on site here, but as COVID hit, we had to send our families back up to Thurston County to get those services, just to maintain everybody's protocols around COVID. We work closely with every law enforcement agency in Lewis County. I received referrals from all of them this year. And I just want to say, around COVID, the cases that have come through in the last few months are the worst that I have ever seen in my entire career. And it's a conversation, this is just the tip of the iceberg, and it's a conversation that we continually have with law enforcement and CPS. And it's like, we're just waiting for the tsunami to hit. As soon as these kids go back to school and have some sort of safe adults in their lives that they can disclose to again, then, it's going to be catastrophic. I have a ton of more demographic information around all of this. And I send out a community partner letter every year going over every demographic that comes through here and the different things that we're doing. If you haven't received one in the past and you want one, please let me know. I'll provide my email address so that I can send that off to you. Another statistic I want to share with you, and I've shared this often, is that economic impact of child abuse. And for those of you who have heard me speak before, I use the number that over $210,000. That's what it costs for each child. And that's what it costs the community for survivors of non-fatal child maltreatment. That number has risen to over $830,000 per child. So for the 112 kids that we're seeing here this year, it could cost our community upwards of $93 million to deal with the aftermath of that abuse. That number went up so much because the culmination of research coming together has given us a better understanding how trauma reduces the quality and productivity of these children throughout their entire lives. And that's a huge jump from 210,000 to 830,000 per child. I would love to talk more about this. And if anybody's interested, I have the research to back this. I have all of the stats around it, and I would love to share that with anybody interested. On a good note, for the last 2 years, I have been borrowing, and stealing to try and find money to buy a mobile unit so that I can go out to our East and West counties to do forensic interviews out there, to meet our families where they're at. And I got that this year, and I've been working with Chief Morningstar, and we're ready to go with the equipment and space to do interviews in East Lewis County. I'm still working with PL in that area on setting something up out there. We haven't done any interviews out there yet, but I expect as things go back to normal, that we'll have more next year, and also letting our law enforcement know that that option is available too, getting that information out. Before I finish, I want to briefly mention that Congress is proposing a 40% budget cut to VOCA funding, which is Victims of Crimes Act. And that directly supports the Youth Advocacy Center. That's how I work. And this is not a tax-funded program. And the short explanation is that it comes from fees that arise out of criminal convictions. And there's a whole bunch to it. We don't have time to get into that. But if anybody's interested in helping us reach out to our representatives to ask them not to make that budget cut, it would greatly help. Because if they do make that budget cut, it's going to be devastating to our program, and I won't be here next year. So thank you for that quick time to kind of let you know what we've been doing, and I hope I get to see you guys next December.
Thank you, Samantha. Appreciate the information. And we'll have emails and phone numbers and things available if any of our panelists or anybody watching this wants to reach out and get more information on any of the presenters today. Trish, you're the last one. I'm going to give you 2 minutes. Trish, are you still there?
I am. I don't have video. Let's see here. I think I got it now. There we are. Hi. 2 minutes. Wow. You know me, Richard. That might not work.
I know.
I will talk fast. I did cut my speech down as we're talking. I did my presentation a little bit. So, you know me, always adjusting to things. So
I do. Yes, I do. We love you, Trish.
So I'm going to share my screen here a little bit just so you guys can kind of see what I'm talking about. Hopefully you guys can all see that. Should say care coordination highlights. I'm going to talk about a little bit real quickly about our CCBHC grant that we were awarded this last year, and what that is, and what does it provide, and what is needed to be able to maintain, and what we're looking at. So as you know, last year, some of you guys may know, we received Cascade Community Healthcare was one of 3 behavioral health agencies throughout Washington State awarded the Certified Community Behavioral Health Clinical Expansion Grant. This is otherwise known as the CCBHC grant. So what does this grant do? CCBHC grant allows us to improve community-based integration, evidence-based, person-centered, recovery-oriented care while being trauma-informed and culturally competent. This funding opportunity has opened up closer relationships with our community partners, benefiting our clients. We are also able to support uninsured and underinsured individuals through the funding provided by the grant. With this CCBHC funding, we were able to provide a more comprehensive range through building a bridge focused on communication and monitoring while working with internal staff and other community partners. Let me give you a prime example of that. With the grant, we were able to fund a care coordination position that supports our clients who also receive care services from Valley View. This position has opened up our ability to provide more effective communication, monitoring, support, and timely services through both facilities. Care coordination permits direct access to each other's electronic health records so we can stay informed and effectively communicate client care. The care coordinator also monitors the client if the client fails to arrive at an intake appointment or skips a needed part of the process, such as scheduling the prescriber appointment. The care coordinator works on bridging communication gaps between the client, therapist, and primary care provider and other community partners. This helps to minimize duplication of services, reduces payment, no-show rates, while also improving timely access to care, including same-day appointments. Notably, we have been able to cut a month off time. It previously took Valley View clients and Cascade clients to schedule an appointment with a psychiatric provider. So that's the work that we've done behind the scenes in order to streamline, because we've been able to more effectively communicate, because we are able to fund a position that oftentimes is not able to be provided funding for through therapeutic services. These are more sometimes administrative type services that we're working on. And so it's definitely been able to allow us to be able to work in a different capacity. I think we all can agree that this is even more important during our current state of COVID, as behavioral health and substance use disorders are on the rise. Here's our dilemma. The CCBH grant is a 2-year grant funded project here in Washington. Our state did not participate in the CCBHC demonstration program, so the grant is limited to individual clinics rather than a comprehensive reform of behavioral health care as it was in the demonstration states. The objective is for us to be self-sufficient and to continue support current to the CCBHC funding positions that typically do not generate revenue, while also permitting us to continue to serve uninsured and underinsured clients. What would make this more sustainable is to see a payment method similar to what demonstration state clinics receive, similar to what federally qualified healthcare centers receive. They bill per encounter versus a fee for service system, like BHAs here currently in Washington State. The prospect payment system has worked very favorable for CCBHC clinics in the demonstration states and has allowed them to pivot services to meet community needs, while also enabling them to retain high quality staff. Although we have heard that Washington may be contemplating moving towards a value-based payment model, another alternative to fee-for-service that looks at outcomes, metrics, and provider incentives. With with encounter-based payments or value-based payment model, we can focus on integration, quality of care utilizing evidence-based practices. We would better be able to provide care coordination, critically focusing on whole person and integrated care, resulting in a high standard of care that ultimately has been shown to improve long-term health outcomes as well as reduce the overall cost of care, particularly for high utilizers. I want to conclude by just saying we are so grateful to basically be a part of the CCBHC grant, and we're able to be awarded it. It was quite a surprise. We're looking forward to trying to make this as self-sustaining within our agency as much as we can. And as we go forward, not knowing for sure if we'll be able to continue the funding that we have after the 2 years or what Washington State is headed towards. If we're able to adapt a similar model to the prospective payment system method or value-based payment method, this would really be able for us to be able to enable clinics across the state to rise the standard of care and will allow our state to be national leaders and innovators on the front of behavioral health care. I just put up there a little bit on the screen, just those different highlights of what care coordination services kind of provide. Any questions?
Trish, thank you so much. You went over 2 minutes, but that's okay. Trish is one of our stars, and we really appreciate her being on the executive team. She's a great addition and great enthusiasm. And so, Trish, thank you for all that you do. Really appreciate that. I just want to thank all of our panelists for being here. Senator John Braun, Sheriff Rob Snaza, Commissioner Edna Fund, Representative Jim Walsh, even though you weren't able to be on video, thank you for participating. And Representative Peter Urbano, thank you for being here. Thank you for your friendship. Really appreciate it. Thank you to our IT team, Dave Lockhart, Brad Bento, and Dan Benson, and a special thank you to Mindy Greenwood for getting a lot of this coordinated. I hope this was helpful to you, and the idea behind this is just to get information out to our legislators so that they know the needs of Lewis County, because those are the people that we serve, and those are the individuals we're most concerned about. So thank you everyone for participating, and have a great and safe holiday.